Well, welcome everyone. Thank you so much for joining us tonight. I'm Lori Marie Pashota. I'm the Executive Director of the Mental Health Association of Rhode Island. We are a teeny tiny nonprofit based in Providence, and we focus on consumer advocacy. We promote and protect and nourish mental health through policy development, advocacy, education, and research. I'm so happy that you joined us this evening. We have an awesome program for you tonight, one that is personally meaningful to me. First, a few housekeeping tips. Please mute yourself, and unless you have a question, in which case I'm happy to call on you. If you have a question but you don't want to ask it publicly, then you can privately chat it to me or to Carly, and one of us will read the question without saying your name. Second, you should know that this event is being recorded, and we will post it on the Mental Health Association's YouTube page tomorrow, and you can take that link and you can share it with everyone you know to your heart's content, because my philosophy is you never know if someone in your life might be struggling with an eating disorder, and giving them this resource, this encouragement and support could make a difference in their recovery journey. So please share this widely with your friends and family members. Next, I would like to thank our sponsors for May is Mental Health Month 2021. Rhode Island College, thank you so much for being a theme sponsor for this event. Rhode Island College's Clinical Mental Health Counseling Master's Program, their staff recorded a very special, heartfelt message for everyone for May is Mental Health Month, and you can see that on our website. If you go to the May is Mental Health Month webpage and you scroll down, you'll see a link for Rhode Island College. And I've also put the website page here on the slide as well. And I highly recommend watching the video. It's really touching. Thank you so much, Rhode Island College. We love you. Thank you also to Butler Hospital, our platinum sponsor. We love Butler Hospital. We have many friends there. You're a wonderful hospital, wonderful staff, so compassionate and caring. And Butler, as you know, if you're from Rhode Island, is located in Providence. Thank you so much, Butler, for supporting May is Mental Health Month this year. And now let's begin our program on being safe, seen, and heard, the significance of safe places of healing for Black, Indigenous, and people of color with eating disorders. Tonight, we are so lucky to have Giva Wilkerson as our special guest. Giva is the program director, team leader, and support group leader at the National Association of Anorexia, Nervosa, and Associated Disorders. A native Philadelphian, Giva is a graduate of the University of Pittsburgh and Indiana University. She currently resides in Brooklyn, New York. Having experienced her own eating disorder recovery journey, Giva understands how significant the support of caring and experienced individuals can have on the healing process. Often referring to herself as a natural big sister, Giva believes nurturing and mentoring younger women to be her life's purpose. Thus, she has worked with women and youth the majority of her career, designing educational and leadership programs, as well as providing social and emotional counseling and training. She's also worked as a blogger and entertainment correspondent. She most recently worked at Project Heal, another eating disorder organization. And when Giva's not working, you can find her volunteering with organizations serving underrepresented communities and victims of trauma. The causes closest to her heart include girls' leadership, racial and reproductive justice, and mental health awareness. Giva is a trained sexual assault crisis counselor, mental health first aid worker, and vinyasa yoga teacher. In the near future, she hopes to train to become a yoga therapist, which will allow her to continue her love of mental and physical health with the holistic healing practice of yoga. I want to say that I personally have worked with Giva at Project Heal, and every word I just spoke is absolutely true. She's left a lasting impression on me as one of her coworkers, and I know Giva to be someone who is kind and genuine and completely dedicated to serving others. Thank you so much for being with us tonight, Giva.
Oh, thank you, Lori, and likewise. I mean, you know how special you are to me. Lori is one of a kind and one of the most genuine and most authentically beautiful people I've ever met in my life. So thank you so much. It means so much being able to work with you again.
Oh goodness, thank you so much, Giva. Don't make me cry. But thank you very much. I appreciate the kind words. It means a lot coming from you. Also tonight, we have with us Giva Wilkerson, who is in the top right corner of my screen, besides Giva Wilkerson. And then also we have Carly Dorefsky, who is one of the Mental Health Association's interns from Brown University this year. She's been a wonderful intern, and she's so kind and smart and talented and enthusiastic. And we're so grateful to have her support, her service, and her leadership this year as an intern. So thank you, Carly, for helping us organize this workshop and for moderating it for us tonight. We really appreciate you, Carly.
Thank you so much, Lori.
And so now I'd like to begin with a first question for Giva. And that is, as many of you might know, I've spoken about this publicly in previous settings, but I have lived experience with mental illness. And one of those mental illnesses is anorexia nervosa, which I struggled with over 20 years ago when I was in high school. And I did a 4-week stint in a residential treatment facility. And then I had 4 weeks of partial hospitalization. And then I had about 15 or maybe a little bit longer, 15 months of outpatient therapy with a wonderful therapist who really, I think, is credited with much of my recovery journey. And so this conversation is personally meaningful to myself, and I'm so grateful to have this with all of you. But just to set the stage for people who might be new to this topic, Giva, can you tell us what it means to have an eating disorder and what it may look like when one has an eating disorder?
Sure, Lori. So an eating disorder is, first of all, it's a serious mental illness, okay? It actually, and people can die from an eating disorder. So this is something to be taken very seriously. It's just characterized as a behavioral condition that has characteristics of severe and persistent disturbances in eating behaviors, as well as maybe body image challenges, okay? But it also is not about the food in the body. It's also about the thoughts and emotions, the stressful thoughts and emotions. So it's a mental illness that really is characterized by not only having challenges with food and body, but also there's a mental illness, a mental component where people are having very difficult thoughts and emotions around food and body and just themselves in general. When you talk about what it can look like a lot of different things. So, eating disorders impact all different aspects of your life, right? So there are social components to an eating disorder. There are definitely physical aspects to an eating disorder, but, very much so psychological aspects to an eating disorder as well. Eating disorders it can affect anyone from any walk of life, okay? Eating disorders do not discriminate. Our society discriminates, eating disorders do not, okay? So we're talking about people from all different backgrounds, all races, all ethnicities, all genders, all economic backgrounds. Eating disorders do not discriminate at all. There are lots of contributing factors to who may develop an eating disorder. It could be, there has been studies that have been shown that eating disorders can be genetic. It can be the result of trauma. And there also are social aspects to an eating disorder. But one of the things I do want to actually, I don't want to I want to underscore actually is the societal aspect of eating disorders as well, particularly here in the US, because we do have such a high prevalence of a diet culture here, this thin ideal here, as well as fat phobia here. So it's like you put all those things together, someone who may be experiencing their own co-occurring mental illness such as depression or anxiety. On top of that, they may have some social or some trauma that they have experienced throughout their life. And then you put that together with our society, which values this thin ideal and extremely fat phobic. It just creates a perfect storm for people to be more susceptible to an eating disorder.
So Giva, you kind of mentioned how eating disorders, they don't discriminate. So I was hoping that you would touch upon some specific challenges faced by specifically the Black, Indigenous people of color in the eating disorder community.
Yeah, definitely. So, one of the things that pops in my head when you ask that question is just the idea that we're not believed. We are significantly underdiagnosed when it comes to eating disorders. And I think a lot of that is because of what people, think eating disorders are and who's impacted by eating disorders. There's a stereotype about who has an eating disorder. When people say eating disorder, a lot of times people think about anorexia, which is often attributed to people being very thin, people restricting their food or not eating their food. And people think of this very thin, often middle to upper class young white woman. And because that stereotype persists in so many people's minds, and professionals even believe this, years ago, that these were the only people who were susceptible or experienced eating disorder, because people still think that if someone comes into their office who is a Black, Indigenous person of color, or does not, or is in an average or larger size body, they may be ignored, they may face disbelief, or they may just be dismissed, or told that they are misdiagnosed with something else. So that is one of the biggest things. Myself included, I've experienced that. I had a lovely doctor, a family doctor for a long time, treated my entire family. And there was a period of time where I had lost a significant amount of weight. And I went to him and I said, I think something's wrong. And I knew that I had been restricting. I had suffered from anorexia for a very long time. And, he said, whatever you're doing, keep it up. It never occurred to him that I could have an eating disorder. I could be restricting. I could be binging and purging. It never occurred to him that I could be suffering from an eating disorder. Even now, I remember going a couple of years ago to a new doctor, to my gynecologist, and I'm filling out the form of my health history. And I put on the form that I had dealt with eating disorder, that's my life. That's part of my medical history. And I remember the nurse looking up at me and just gave me this look of just confusion, and just looking back down at my form and just like walking away. And so I think people have this perception of what it looks like to have an eating disorder in their mind, and it's very hard for them to step out of that. So I think that's the first thing that BIPOC face when it comes to dealing with an eating disorder. Another thing is just the stress and trauma of being in a marginalized community. I actually was rewatching a webinar conversation where Dr. Norman Kim was actually talking about the correlation between being in a marginalized group, such as people of color, and then also the connection between that and eating disorder. You're more susceptible to an eating disorder if you're dealing with the stress and trauma of being in a racist, community, a racist society. So it makes sense when we would see a prevalence of eating disorders amongst people of color. He even said that not only, and this is true in a lot of research, that people of color, BIPOC, Black, Indigenous people of color, not only experience eating disorder at the same rate as their white counterparts, but even in some cases, higher rates of eating disorder. And that can be attributed to this stress and trauma of being in a marginalized community. Another thing that can be particularly stressful and hard for BIPOC is, finding treatment that is accessible, but also culturally competent. It's bad enough to have to deal with a mental illness, mental illness is stigmatized in our culture, period. But dealing with a mental illness that people think they think it's something elective about it. They think that eating disorders can be dismissed. They don't think they're as serious as they are. But then also having to go and seek treatment and support and also feel like you're othered. and people don't understand you and don't understand the want you to teach them about who you are before you can seek support and guidance and treatment.
And you touched upon this a bit, but if you had to kind of like, and I know this is very abstract, but think about why some of these challenges do exist, especially just this like very scary tendency to just dismiss BIPOC individuals. Like, what would you kind of, can you speak toward maybe why this is occurring?
I think it wasn't until recently that people started to really dive into and start to do research on just underserved and underrepresented communities in the eating disorder kind of field. Once again, this has been seen as a middle to upper class young white woman's disease or illness. And so it wasn't until recently people started to say, no, this is not true. And they started to really broaden their mindset around what an eating disorder is and who has an eating disorder. So I think that the science is really just catching up and people are starting to really open their minds to really want to learn more about what an eating disorder is and who's impacted. I also think that just there's so much misinformation. And going back again, talking about just the underdiagnoses of people with or people BIPOC with eating disorders. And also, I think, and I'm speaking for myself when I say this, for me, I suffered from an eating disorder for, God, most of my life. And I knew something was wrong in something was going on. I had really strong feelings about food and about my body, really disturbing thoughts and feelings about food and body. Um, but I was so afraid to say anything because one, I knew no one like me who was dealing with this, at least not to my knowledge, talking about it. The images I had were definitely didn't represent me. But then also there was this fear that if I told people this, I'm already being othered. I'm already being seen as oftentimes maybe I had to assert myself as being intelligent enough to show up in this space, strong enough, or worthy enough to be in this space. But then to admit I had an eating disorder, which is a mental illness that is so deeply stigmatized, I wasn't going to speak up. And I understand why so many people wouldn't speak up. So I think that contributes to all of this really the shame of it all, the misinformation of it all, the underdiagnosis of it all, and then just the ignorance of it all.
And thinking about this like shame that's really encompassed within having an eating disorder, I think a word that I've recently been hearing a lot when talking about mental health recovery in general is this need for a safe space. So I was hoping that you could talk more about how would you define what it means to have a safe space in terms of mental health recovery, and also why you think BIPOC need safe spaces to discuss their eating disorders and help recover.
Yeah. A safe space is a place where you can come as yourself. You can be, one of the things we do at ANID, that's the organization I work for, and we have a BIPOC support group. And we define a safe space as a place where you're surrounded by peers. We do peer support, which is really important to us. And these are people who have that same lived experience as you. So when we were putting together these support groups, it was really important that we, one, had support group leaders or facilitators that were representative of the group of people that we were bringing into this space, so that no one felt the need to come in and explain who they were. BIPOC need a space where they're not being othered. They can be seen as an individual and not a representative of their entire group. And for many of us, I can't speak for everyone, but for many of us, we are often the only ones in these spaces. I've been, even as a professional working in the eating disorder field, when I come into meetings with my colleagues, I'm the only person of color, often the only black person in the room. And so I couldn't even imagine being in my eating disorder, trying to seek help, and then having everyone there who is not culturally competent, who is seeking to learn about who I am before they can support you. So that was really important that we had facilitators that were representative of the group of people that we were bringing in, that people were culturally competent, meaning that they were going to come in, they were open to learning, because none of us can know everything about every culture, every person we interact with, but open to learning, open to keeping our minds open to allowing people to be themselves and express themselves. And then, you know, also just really making sure that we were accessible. Now, we are still working on getting more groups up and running, like a Spanish speaking group and, you know, all those different things, but accessible even in the way we talk about eating disorders. So, you know, until I got into this field, I wasn't familiar with all the terminology that people use. You know, if you're not familiar with all the different types of treatment, someone comes in there talking about CBT and DBT, and they're talking about, and they're, or even saying anorexia nervosa or bulimia. These might not be terms that everyone's familiar with. So one of the things that's really important, particularly in the BIPOC space, is that even as support group leaders and as participants, we're open to explaining what we're talking about, so that we're not using terminology that people may be unfamiliar with. So even when I'm leading the group, if someone says, "Oh, and I went and, you know, and I did my DBT," I'm like, "Oh, I'm not familiar with that. Could you explain that to me?" So that I put myself out there so that it can be explained, so that I don't have anyone else who may be new to this illness or new to these types of treatment. They don't feel like they're lost in this. So we really want it to be an accessible space for everyone, so that people feel welcome and they feel safe enough to be real and be honest about what they're experiencing. You know, another thing is something that is very common, and, you know, and we're trying to break down the need for people to do this, but the idea of code switching. Many people of color come into spaces, particularly predominantly white spaces, and we've been taught and conditioned to adjust to that space, as opposed to coming in and being authentically ourselves. And what I mean by that is changing the way we speak, changing the way we might dress or present ourselves, so that we will be less stigmatized and we'll be less othered. There was a time where, for instance, wearing my hair this way would have caused controversy. So we wanted to make sure that we had a space where people felt like they didn't have to come in and code switch. So if that means that they're going to use African American or Black vernacular, that's perfectly fine. You can turn your accent up. You can be the person you are when you feel safe with your family and friends. You can come into this space and you feel accepted, because we're talking about something so deeply personal and sensitive. Having to worry about how you show up and present yourself is something people should not have to worry about.
And I'm sure everyone would agree with me when I say that it's very inspirational how you took it upon yourself to really help create this community of support. But as someone who yourself has been very open about your own experience, of your own lived experience with your eating disorder, what was the support like when you were going through that? Like, did you have this support yourself?
Oh, the short answer is no, but then I sought it out. So it took me a really, really long time to admit I had an eating disorder. There were little, like, I mean, people would make comments about certain things I would do. And I will say that I was never someone who was very, what the stereotype, very thin in my eating disorder, even though I did restrict. I had anorexia and I did restrict. And, you know, it was only at a small portion of my illness where I actually, what people would call maybe underweight. And that, we know that that doesn't mean anything, right? Overweight, underweight, what does that mean? And so therefore I didn't have a lot of people coming to me and saying, "Oh, you look like you have an eating disorder." So people weren't particularly asking me about this. I knew that I was doing something. I didn't know why I was doing it, because mine was attached to trauma and very low self-esteem and a lot of things that I was experiencing in my life. Because eating disorders, once again, it's it's about the food, but it's not about the food as well, you know. So I didn't seek out community, and I didn't have people reaching out to me to ask me to be a part of their community in regards to my recovery. It did hit a point where I did seek out therapy, and I went to my, actually, a regular therapist. She wasn't even an eating disorder specialist, and she said to me, she said, "Do you think you might have an eating disorder?" And I knew the answer was yes, but of course I said no. And I started going to therapy and getting support from her. And then I did start to reach out to some of my family, and not specifically about my eating disorder, but I reached out to my aunt. She actually let me move in with her. And I tell this story all the time. She said, "Just come and live with me, and, I'll take care of you and I'll mommy you." And, and I was very much an adult at that point, living on my own, but I stopped and I moved in with her. And I realized that what I really needed was love and support. And I would not have been able to do it without that. I would not have been able to have the strength enough and and I guess the space and the freedom to take care of myself if I hadn't been taken care of by someone else. And being taken care of shows up in a lot of different ways. So I think, the sense of the reason why community is so important to me, and the reason why I'm such an advocate for community, is because support and being taken care of is such a huge part of healing. And what I found is that people with eating disorders, it's not just about, I don't use these behaviors anymore. I don't binge, I don't restrict. And please, and binging is, eating an excessive amount of food in a specific period of time to the point where you actually don't feel comfortable, or restricting, meaning not eating at all, or purging, which is eliminating food either through a lot of different methods. But there's a healing component that's needed, and community really does inspire healing.
Giva, thank you so much for talking so openly about your very personal experience with an eating disorder. For me, I think I relate to what you're saying about the love and community that was integral to being part of the recovery. That was exactly my experience. The love and community I found was with my therapist, Rhode. She was the first therapist I've ever had. She was unlike anyone I had ever met in my life at that point. She was like a role model and like a very nurturing, supportive, motherly figure. And I think what pulled me through and what gave me the will to fight my urges for restricting and over exercising was like what felt like love coming from her, and tenderness that I didn't have in my own family at that time. And I think about the people who might be struggling right now alone and in silence, in isolation. What would you say to someone who is hesitant to come out to their loved ones to talk about what's going on with them?
Ooh, that is so difficult. I always encourage people to talk to at least one person they trust. And what I would say to them: if you don't want to tell them everything, tell them something. Even if it's, you don't want to specifically tell them what you're doing, whatever behaviors you're using, you can tell them how you feel. And if you can't find the words for how you feel, say that I need help and I need support. And just say, I need help with this specific thing. I would tell them it can be very life changing, life saving for you to reach out to someone. And I will also say that people will pleasantly surprise you. When I moved in with my aunt, she had no idea. I think she might have suspected. She never told me that she suspected. And, but she was just there. And we didn't have to talk about it. You don't have to go into details. You can just say, hey, can you sit with me for a little while? When you have the urges and you want to use behaviors, you can say, can I call you sometimes when I'm feeling sad? And you'll be surprised. People want to help. People want to feel useful. And so just give someone a chance. You can also go and seek out spaces with strangers. I think we often forget the company of strangers can be quite therapeutic. It's, you don't have to tell them your life story. You don't have to worry about seeing them the next day if it doesn't go well. So seek out an eating disorder support group. Anid, we actually have 11 support groups open. 6 of them are open to anyone from any background. And we have 5 affinity support groups for special populations. So, whether you're a BIPOC person, that is one of the groups we have. If you're a teen, we have another group. If you are a person in a larger body, we have that group as well. We have one for older adults, another group that's often ignored and underserved in the eating disorder community. And we also have another one for LGBTQ plus individuals. So you can join a support group and just check it out. And just really to get your feet wet in talking about your experience. And then you can kind of hone your language around what you want to disclose before going to someone close to you, if that feels more comfortable.
And then Jiva, on the flip side of that, do you have any advice of if you maybe have a loved one, a friend or a family member who you think may be suffering from an eating disorder and maybe they haven't said anything, how to approach that kind of from the perspective of a loved one?
Wow. you don't have to come to them and speak specifically about the eating disorder. You can, because you never want to speculate about what a person's doing or what they think or what they feel. But what I would recommend they do is approach them and say, I love you, I care about you, and these are the specific things I'm observing, and I'm concerned. And I want to be here in any capacity that you want me to be in. So you want to be very mindful not to accuse them, to throw labels at them. It can be very hurtful or harmful for someone who maybe hasn't come to the realization that they have an eating disorder themselves to have someone say, you have an eating disorder. I think you're sick. I think you're ill. I think you need help. That could be really, really jolting for them. So you want to just, you know, let them know you're going to be there regardless, and let them know what you see and let them know that you care, and just give them the kind of the reins to come to you for additional support. And then just be patient, because sometimes it takes a little while.
Thank you so much, Giva. Where can people go to learn more about eating disorders and to receive support in their own recovery journeys?
Yes, you can always go to ANID, ANID.org, ANAD.org. We have tons of information about eating disorders, different types of eating disorders. You can come on board to one of our support groups if you are actually someone who is living with an eating disorder yourself, or suspect that you might be dealing with food and or body issues. You can come to one of our support groups. You can also get more support by joining one of joining our mentorship program. We actually have the application open right now for anyone who is interested in getting peer support, one-on-one peer support from someone who is recovered from an eating disorder, and looking for guidance and tips and support in your own journey. You can definitely do that. Or you can call our helpline. You can go to our website, call our helpline to get information and information on eating disorders, as well as treatment referrals and just additional peer support.
Giva, do the support groups and peer support services that ANAD offers, are they local to Rhode Island? Do we have a Rhode Island chapter, or should they just go to your website for virtual groups and support?
Right now, all of our support is virtual. So all of our support groups and all of our mentorship is done virtual. We'll see what happens when the world goes back to normal. But as of right now, it's all virtual. So it's accessible to anyone across the country.
Thank you so much. That's awesome. Now is a time where we can open up the floor to questions to Giva, to Carly, to myself. I will also provide Jiva's contact information in a moment, but I just want to give you all in the audience an opportunity to ask your questions. So yes, we will put the website in the chat. Any other questions for Giva?
Just quickly to jump in, I just put the general ANAD website on the chat. Giva, is that the best place to get more information?
Start there and go out, branch out. And if you want, you can always contact me, giva.wilkerson@anit.org, and I will try my best to answer whatever questions you have.
I'll put your email address up right now. Just share my screen. So once again, thank you to our sponsors, Butler Hospital and Rhode Island College. We really appreciate your support for this workshop, and May is Mental Health Month. This is how you can reach Giva. Her email address is at the bottom here. And we also have the website address for ANAD. If you want to take a moment to jot that down, if you know anyone who is living with an eating disorder, feel free to refer them to ANAD. They have lots of resources on their website. And as Giva mentioned, they actually have support groups that you can join virtually from anywhere in the country. And here is my email address and the website for the Mental Health Association of Rhode Island as well. Just looking through the chat one more time to see if we have any questions.
And feel free to message Lori or I privately as well if you maybe don't want to share a question with the entire group.
Absolutely. Thanks, Carly. One question came in. How can you handle an eating disorder when it's more emotional? Perhaps that means when the symptoms are more emotional compared to food behaviors, food-related behaviors?
Yeah, so that's a really interesting question. I think for a lot of people, like I said, there is a behavioral aspect to an eating disorder. So there are symptoms that show up, in terms of how you view your body and how you view food, but also there is an emotional component to it. And eating disorders are often exist in alignment with another mental illness or another mental health condition. So for me, I've suffered from anxiety pretty much as long as I can remember. And so my recovery from my eating disorder did really entail me dealing with the anxiety and getting deep therapy to deal with the anxiety and the trauma that caused the anxiety. So what I would say is that that's very, very common for a lot of people with eating disorders. And Lori, feel free to chime in as well if you want. I know you have lived experience as well. But yes. So I would say therapy, working through the underlying causes, because eating disorders often are actually a symptom of something else going on. We see a lot of people using their eating disorder as a coping mechanism.
Mhm.
So, for me, I held back my food intake as a way of regaining the control I felt like I didn't have in my life. And so I had to work on why I needed that control. And so that's what my therapy basically consisted of. I never really had a lot of therapy specifically around the eating disorder behaviors. It really was about dealing with the trauma and the things that were triggering the eating disorder behaviors. So I think that's very common, and I think the emotional aspect of it is really important to focus on. And I think that's where a lot of times therapists will start.
Giva, thank you for sharing that. My experience, I have to say, was very similar. So my therapist was not, certified in eating disorders. There is a special certification providers can get to become experts in the field of eating disorders, but Rhode was not. We worked on, as you said, my need for perfectionism and my depression and my anxiety and difficulties I had in my family and trauma. It was all of these other issues that contributed to my disordered eating and my restrictive behaviors and my over exercising and my body image challenges. So, I think there is a shortage of eating disorder certified providers around the country, but don't lose hope because of that, because even someone who's not certified can make a real difference in your recovery. That was my experience. Any other questions? Well, Giva, thank you so much for your courage and your openness and your time this evening, and for sharing your story and all of your resources. It's really great to see you and to have this conversation with you.
Thank you, Lori. Thank you for having me. I hope we get to talk again soon.
We will, Giva. Keep in touch.
Thanks. Bye.
Bye, Giva. Bye, everyone. Thank you so much for joining us this evening. And again, if you'd like to see a recording of tonight's presentation, you can find it on the Mental Health Association YouTube page. Feel free to share it on your social media pages, your websites, and with friends and family members. We want this information to be spread as widely as possible so we can help people who may be suffering alone in silence. Thank you, everyone. Take care of yourselves, and we'll see you soon.